This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today we're speaking with Barbara Levy, Senior Vice President of Global Clinical Integration at INVO Bioscience, a medical technology company dedicated to making fertility care accessible and inclusive to people around the world with its flagship product, Invocel, a revolutionary reproductive technology that allows fertilization and early embryo development to take place within the woman's body. And Barbara, thanks for joining us here today on eHealth Radio.
That is my pleasure. Thanks for having me.
And you're certainly more than welcome, and looking forward to hearing from you and all the details on INVO Bioscience and your product, Invocel. So for starters, looking at your flagship product, Invocel, what is Invocel?
Sounds great. So Invocel is a small device where we put the woman's eggs and the man's sperm into this device, which gets put into the woman's vagina. And for the 5 days of embryo development that with in vitro fertilization happens in the laboratory, this actually happens inside a woman's body. So it has the temperature variations, the movement, all the things that a natural process will have. And it allows for a feeling of intimacy with the embryo growth as that happens. So INVOcell itself is just the vehicle. It's the mechanism by which we can put the eggs and the sperm together and allow the embryos to grow.
And that certainly is a very helpful explanation in all regards. Now, if you don't mind, could you share a step-by-step overview of the device? That would be great as well.
Oh, so the device is just a plastic clear device where an embryologist who's an expert in looking under the microscope and picking the best eggs and the active sperm the device has chambers to place the eggs and the sperm together, and then it is sealed, and a gynecologist or a nurse practitioner can place the device then into the woman's vagina. It's quite small. It feels totally comfortable. We call that wearable, but women don't really know that it's in place once it's in. A little bit like a diaphragm or a cervical cap. And it allows then the embryos to grow at natural body temperature over the 5 days or so.
And that's quite a helpful visual there, and thanks for that. Now, how does it compare to other fertility approaches, and what is the success rate with IVC?
So IVC is really intended for those people who need access to what we call advanced reproductive technologies. It means perhaps the woman's tubes are blocked or she's had a tubal ligation and now wants pregnancy. It may be for people who don't ovulate regularly and have tried medical therapy. They've tried some drugs and that doesn't seem to work for them. This is a step perhaps earlier in the process than growing the embryos in a laboratory. So it's also useful for people where there are problems on the male side and we need to concentrate the sperm and select those that are best to put together. Currently, in vitro fertilization is a very expensive process because the laboratory to grow the embryos has to be very, very clean. It has to be at a specified temperature. It has to be overseen by an embryologist throughout the growth phase of the embryo, and we're bypassing that process. So for a woman desiring a pregnancy, we will still stimulate her ovaries with medications so that we can retrieve her eggs. That's bypassing the fallopian tube, and then select for the good eggs and put them in the INVOcell. Similarly, we can select for good sperm. And so it's bypassing problems that occur in a natural fertility process. When the right patients are selected for this, the outcomes with IVC are quite similar to those for in vitro fertilization, which means probably about depending on the woman's age and the age of the eggs, it can vary between, let's say, 30% and a 45% pregnancy rate per cycle. And that's quite similar to in vitro fertilization.
Barbara, thanks for your thorough response to that question. That is most helpful and appreciated. Now, also, how often can INVOcell be used?
It can be used repeatedly, just like you could do repeated cycles with in vitro fertilization. Um, Most people would not choose to do that. And what we can do is if we get several embryos that are good looking embryos, we can freeze the ones that we don't place back into the uterus in any cycle. So we may have additional cycles we can do with the embryos that we've grown during INVOcell. Much of that depends on the quality of the woman's eggs and the quality of the embryos that are grown during the 3 to 5 day period. So there's no real limit to the number, except for, of course, the cost and the disruption in people's lives of having to go through these medical procedures. Even though they're non surgical procedures, they still take a lot of time from a woman's life to be present to have all of those things done. The great thing about INVOcell is that it's considerably less expensive than in vitro fertilization with, as I said, similar results. So for couples that just can't afford the typical $12,000 for an in vitro fertilization cycle, this makes that advanced technology much more accessible for people.
On the program today, we're speaking with Barbara Levy, Senior VP of Global Clinical Integration at INVO Bioscience, a medical technology company dedicated to making fertility care accessible and inclusive to people around the world, here on eHealth Radio's Fertility and Health News channels, a part of the eHealth Radio Network. Now, I'd be curious, what age groups typically utilize INVOcell the most?
So, like any other advanced reproductive technology, the success rates are better the younger the patients are. And we're seeing patients, from their late 20s into their mid 30s. I would suggest that INVOcell is probably not the best treatment for women, what we call elderly, which really disturbs me quite a bit, but women over 35 or 36 trying to achieve a viable pregnancy, likely in vitro fertilization will be a better choice for them. Their success rates with any of the advanced reproductive technologies go down with the age of the mom and the age of the eggs. Older women can do INVO and do it very, very well if we're using donor eggs. So unfortunately, women's reproductive lives are limited. And as we get older, our eggs are not as accessible. They're not as viable for a good embryo. So best choice for INVOcell would be women in their late 20s and through their early to mid 30s.
Also, in addition, would you mind providing insight on the price comparison to IVF?
Yeah, I mean, it's half or a third in most places. Obviously, physicians and clinics can choose to price things however they want to price things, but the cost of advanced reproductive technology is really dependent on a couple of things. It's dependent on the medications that we use to stimulate the ovaries to produce eggs. So for a typical in vitro fertilization cycle, we stimulate aggressively to achieve 20 eggs or 30 eggs to try to get the number that we need for in vitro fertilization. For INVOcell, we typically will do a lighter stimulation, we call it. We don't need 20 or 30 eggs. If we can get 3 to 5 eggs, we're very comfortable. So there's a lower cost to the drugs. And then when you use those medications to stimulate the ovaries, you also have to follow hormone levels in the blood and the appearance of the ovaries on ultrasound. So there are multiple additional tests that are done, typically with the stimulation for in vitro fertilization, that we can avoid with INVOcell. So the savings is in multiple areas. It's in the cost of the laboratory, it's in the cost of the medications, and it's in the cost of all of the testing that's done throughout the process. And all of that can be more efficient and can be done at a lower cost for most couples.
Yeah, thanks for your response and information and details there. Now, what is the overall consensus on INVOcell in the OBGYN community? I'd be curious to hear some feedback on that.
I think that so many general OBGYNs like myself don't really know much about it or haven't even heard of it. It's not a new technology, but it hasn't been widely publicized. There haven't been a lot of research papers published in the general obstetrics and gynecology literature. So it's, in the fertility literature, but most of us who are general OBGYNs don't usually read that. So part of my excitement about being here with you today is to get the word out to people. Yes, there is research. Yes, it's been well studied. There are great comparisons in a very large database of reproductive clinics called the SART database, looking at INVOcell compared to in vitro fertilization and demonstrating the effectiveness of INVOcell. But unfortunately, the word's not out yet, and we're hoping to get it there.
And of course, Barbara, we're certainly pleased to be a part of getting that word out. Now, also, where is INVOcell being used right now, or any input on that would be appreciated?
Absolutely. So there are some in vitro fertilization clinics that are also offering INVOcell to their patients, and you would have to get on the website in your local area to find those. We also have INVO centers, places where INVOcell is being used exclusively in Atlanta, the Bloom Fertility Center, and in Birmingham, Alabama. We are developing centers in San Francisco, in Tampa, Florida, in Kansas City, and Louisville throughout this upcoming year.
Certainly sounds like a lot going on and in the works. Good stuff there. Now, how many pregnancies have been conceived with INVOcell so far?
Hundreds. It's quite a few. It's not the thousands that have happened with in vitro fertilization over the last decades, because it hasn't been available that long. But we have hundreds of very happy couples who have INVOcell babies, some even more than one.
Barbara, we certainly do appreciate the report and for your time spent with us here today on eHealth Radio. Certainly informative. And I'm sure listeners want to know where they can get more information on INVO Bioscience as well as the flagship product INVOcell. Where can they get the details?
It is INVOcell, INVOcell.com.
And that certainly works, and we'll leave links accordingly within the show notes of this broadcast, as we always do. Barbara, all the best. Thanks for joining us here today on eHealth Radio.
Thanks, Eric. My pleasure for being here.
Again, we've been speaking with Barbara Levy, Senior VP of Global Clinical Integration at INVO Bioscience, a medical technology company dedicated to making fertility care accessible and inclusive to people around the world. And for all the details, visit INVOcell.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.